Hey, good Tuesday afternoon, everyone. TJ Alls, I-45 Now and Galveston Now, along with Dr. Philip Keiser, the CEO of the Galveston County Health District, as well as the local health authority for Galveston County, joining us. We took a week off last week, but we're back at it today. And if you have questions regarding COVID or any health issue, in fact, by the way, we do want to try to expand this a little bit beyond COVID if we can. You can go ahead and ask those questions of us. We'd be more than glad to hear from you. Sorry, let me adjust my light here, folks. We're a little bit too bright here for you today. Dr. Kaiser, good to see you again, sir. Thanks for coming on with us. We appreciate it.
Hey, how are you?
And we've been hearing a lot this week, particularly since right before the weekend. A lot of states are seeing hospitalization rates go down. While the number of people who test positive for COVID-19 is still high, the number of folks actually getting sick or really sick or going into the hospital is dropped down here. And so we're seeing some restrictions lifted and stuff. Let me just ask you point blank, is the variant on its way out? The COVID-19 Omicron variant just kind of go on its way out now?
I hope so. It's a really good question. We're seeing our numbers drop, and they continue to go down every day. If you look at our website, you can see that curve there, and they continue to drop day by day. So if it continues at this rate, right before Mardi Gras, we should have some very, very low levels of COVID. And then I think that will be the real test once we go through Mardi Gras and then go through spring break to see, once we have a lot of people coming down to the island and people milling about, and of course, the rodeo is going on. If we see a spike in a couple weeks after that, well, that tells us we're still going to have some problems. But if we don't, I think we're in a very, very good spot.
In fact, as you take a look at the chart right there, folks, what you kind of see January 11th was kind of the spike day where we're hitting around 700 positive cases on that day. And since then, it has just gone down pretty much as you predicted it would now, as we are now almost exactly 1 month from that date. You had said that we would see this kind of spike and then just this roller coaster drop down. That's what the trend had shown with Omicron, particularly out there. So this is pretty much kind of I don't want to say predicted, but as we had seen it happen elsewhere.
Yeah, and so we modeled it based on what we saw in South Africa and Great Britain, and the numbers were doing exactly this, and so we were very optimistic that as time went on, we would see the same thing. Although I was a little cautious, in part because not every country had the same type of curve, and so I'm very happy to see that what's happening, at least in Galveston in our region, is very similar to what they saw in South Africa.
So we go from having around 700 positive cases a week to right now the average positive 7-day positive cases is 125, and we're seeing these kind of big decreases, especially week to week. This week being about almost half the number that we saw before. But it gets into the question now is, are we done with COVID? Now, mine has an exclamation point instead of a question mark here because we've always heard folks saying, all right, I'm done talking about this. I'm done dealing with it. As I said, we see a lot of New Jersey today will be lifting their mask mandates in schools, for example. New York also considering that. Obviously, Texas already had that lifted. And even school districts that were kind of bucking the governor's order have said, okay, we're going to go ahead and lift those now. But at this point, given how many folks have said, listen, we just got to live with this now, even those who are pro-vaccine and pro-wearing masks and doing the right thing, even those folks are saying now, we're done. And so now, how does that come into recommendations for a health expert like yourself when so many of, let me just put it this way, your patients in this case will say, not going to do it. Find something else, but I'm not wearing a mask. I'm not going to, do 85 feet social distancing. I know I'm exaggerating that. I'm going to go to the restaurants. I'm going to go to the bars. I'm going to go out and enjoy myself. What do you recommend to those folks now? Because they are, just as it says here, we're done with it.
Well, people are really tired of it, right? I'm tired of it. You're tired of it. And it's been a really, really long haul. And so I think a lot of us would like to be able to say, absolutely, we're done. But my light's flickering. Let me turn that off.
You and I both having light problems today.
So I would love to say we're done. I don't know that we can say that. I believe we're in the end game, and I'm very optimistic that as we go through spring, that we may have and early summer we may have some spikes, but nothing like we've seen before. But we do have to keep in mind that this virus has thrown us curveballs in the past, and so we never know what's going to come. And so we do have to be vigilant. And so as a public health official, that's one of the things that we have to do. We have to keep very vigilant and follow the trends. But right now, the trends are looking good. And so we're all very happy about that. What should you do? Basically, I think it depends on your risk. And this is something we would encourage everybody to honestly sit down, take the emotion out of it, take the politics out of it, take what you hear from YouTube and what your cousin tells you and what the internet researchers tell you. And really just look at yourself and ask yourself the question, if I were to get COVID, what would happen to me? And if the answer is that, I could get really sick, well, then I think you should continue to wear a mask and you should be careful. We know that there are people, even though they've been vaccinated multiple times, will still get very sick if they get COVID. And we know who they are. They're people who've had cancer and transplants and other types of immune deficiencies, very elderly people. Those people need to be really careful. On the other hand, if you're 25 years old and you've had your 3 vaccines, the chance of you getting sick from COVID is almost nothing. You may get a little sick for a period of time, but you're not going to get hospitalized and you're not going to end up in the ICU, and a normal, young, healthy individual that's been vaccinated. So people that don't want to get vaccinated, I don't know what else to say. We've said it all. The vaccines are out there anytime someone wants to get them. But really, I think that people are going to have to decide for themselves how to navigate this, because less and less we're seeing people willing to do the extreme things that we did early on in the pandemic.
But one of the things there was an interesting article I read comparing how the country dealt with the 1918 flu, and while we call it the 1918 flu, it didn't end in 1 year. It was basically a 3.5, almost 4 year period of dealing with that. And some of the comparisons, what did we learn in year 3 from that as we have now? And it is, and you have said this early on, is that there was actually in the 1918 period, an anti-mask, almost like a political party that was out there. The truckers we're seeing in Canada right now at the Canadian and U.S. border, that a lot of those things that we're here now, we're seeing them in a bigger form and it's more readily visible, but we're seeing a lot of the same reactions we saw more than 100 years ago.
Sure. And what we hope happens for us isn't what happened during the 1918 pandemic, which was that 1920 year, which would be the analogous year, was actually their worst year. And that's because people just threw caution to the wind and the virus changed, except the virus changed then to be actually much more aggressive and worse. And so there were a lot more deaths that year. So far, we're not seeing the same type of thing happening, but that doesn't mean it couldn't happen again. I heard one person, and it's actually the dean of the School of Public Health in Brown. He says, we should think of this like COVID, like it's weather. When the weather's bad, we wear our raincoats and we wear warm clothing. When it's not, we don't. And so we just have to be prepared for times when the numbers go up, for people to be careful, to stay home, to wear masks. If you haven't had your booster, go get your booster. If you haven't been vaccinated, really think about getting vaccinated. And when the numbers are going down and everything's fine, you don't need to wear a raincoat. And so I think we're in that time right now where we don't necessarily need our umbrella right now today, or you don't need it as, depending on who you are and what your situation is. But for the average person, with the numbers going the way they are, things are looking good.
Let me question to have asked along those lines as we take a look at our numbers here. I wonder too, because in the last several shows, you and I have both talked about is that are we talking about the right data when we talk about COVID now? Because there are vaccines on the market, there are now therapies on the market, not maybe as readily available as we would like, but there are treatments that are in the form of pills or some type of, the immune boosters, the infusion therapies that do work. out there that the approach is, let's, we can look at all we want about that 79,707 number out there, but in all reality, and we can say, oh wow, there's 8,000 cases. That sounds like a large number, but we take those 8,000 active cases, that it's really at 65 in the hospital. Right. Those would be the ones who are sick. You and I started talking about this more than a month ago, but should we be really talking about, okay, I don't want to downgrade it to the flu, but I'm just saying, hey, like you use the weather analogy. That may be the best one here is, okay, right now, this is a regular storm, rainstorm right now. That's the 65 people in the hospital. But if we see a thunderstorm, that's going to tick up. And if we see a hurricane, it's really going to tick up. Using that comparison on the line. Should we be taking more of paying attention to how many people are getting seriously sick and how many people are being hospitalized, and not necessarily looking at this larger number of the active cases of 8,000? It was one thing to do that beforehand, but now it seems like more and more cases are manageable. Or mild symptoms, or people are able to just handle it at home, versus before where the percentages were a little bit different.
Yeah, well, those numbers tell us different things, and they tell us different things at different times, right? And so, when you saw those numbers going up in 2020 in July, those were all people that had never been infected. There was no vaccines, there was no immunity, and the death rate was much higher. We started off with a death rate of almost 3% of the people. Now we're down to a death rate of about 0.8% of the people of total number infected. So what that tells us is that so far the virus has been changing. It's been changing in a way that it's been more beneficial to us, in the sense that it's not making people as sick, but it's also beneficial to the virus. The virus's job is to infect as many people as possible and keep propagating itself. And if it kills everybody, then that's not a very successful virus. And so, we see the virus go from one person to another and causing less symptoms. That means the virus continues to propagate itself. So that's why we're seeing this sort of thing from a biologic point of view. But if we go back again to think to 2020, we talked about flattening the curve. Why did we want to flatten the curve? Because we didn't want to overwhelm the hospitals, and we didn't want the hospital systems to collapse. And we came pretty darn close here. And you looked at New York, and you look at New Orleans. They really had big problems where they weren't able to care for people as well as they could have, because the hospitals were just under such pressure. And so now what we're seeing far fewer percentage-wise being hospitalized, but the danger from Omicron was different. It wasn't that it caused a high proportion of people to get sick. It's just because so many people got it, even though it was a small number of people getting sick. At one point, there were a lot of people in the hospital. That number's decreasing as well. And so I think those are the real metrics we need to look at. What is the ICU rate? What's the ventilator rate, the number of people that are actually on a ventilator? What's the number of people in the hospital? What are the number of people that are in the hospital because of COVID, i.e., they went there because they were sick, versus I broke my ankle, and when I went to the hospital, they tested me and they found I had COVID. And during the last surge with Omicron, we saw a lot of people that were sick with COVID, not sick from COVID, i.e. they had something else and they also had COVID.
And to kind of give that perspective back, we go to July 3rd, 2020. This is approaching July 4th weekend. The beaches were being closed around here. Really upset a lot of folks. And at that point, the daily positives rates was around 324 a day at that time. And that was its peak at that. But it had been going up considerably, where it was 29 and 30. Then all of a sudden, it was in triple digits, going up all the way through. And this is 2020. At this point, there is no vaccine. There's the only kind of therapy was actually done widespread that was working was proning. Basically,
that's right,
flipping someone over on their stomach. There was some hope with remdesivir and some other things that were happening at the time, but really had not taken hold yet. And then you compare that, and that's why I'm bringing this up to folks to understand is that, all right, let's look at the number of daily positives, July 30th, 2020, which would have been, this is with no protection whatsoever out there in all reality, to what we just had a month ago, the daily positives at 790. But as you said, if you then go and take those same numbers and percentage of those people who are in the hospital or super sick, and the like, the percentage number is way down
Right.
on this 894 daily positives compared to the 301 daily positives in 2020. And that's why I was talking about looking at the numbers in a real perspective.
Yeah.
Like you
Yeah.
said, flattening the curve was never about just not getting sick. It was about making sure we didn't overwhelm our healthcare system.
Hospital. Right. Right.
Right. And that's been, and I think that got, at some point that gets lost by a lot of people. I think this is where data can go wrong. That's why I've appreciated what we do on this show, is that we just talk about with the numbers, but we put them in a real perspective. We just don't blow out the headline and say, this is how many people have it. Well, yeah, but it's still, the reality of that is how many of these people are really sick at that time.
Yeah.
Higher percentage sick in 2020 of a lower number of people, but here, even with a higher number of people, a lower percentage. And then that's a big part of the case that we need to, make that argument for, to go along the lines with that. It goes to what I've asked you in the past as well, is, okay, as we declared, earlier on, a lot of people are saying, I'm done dealing with COVID. I'm not going to let it run my life any longer. I'm vaccinated. I'm doing what I'm supposed to do. But those who are out there, if there are those that don't get vaccinated, which put others at risk, obviously, and their risk is higher, what should they be doing anyway that they can do in everyday life? And I want to go back to what you were telling us early on, the early days of this. Wash your hands, don't touch your face. That pretty much is still the same argument, right?
Yeah. Yeah. Wash your hands, don't touch your face. Be careful about getting too close to people. Wear a mask in the appropriate situation. And something that I keep hammering on is be mindful. And this is something, that when people start arguing about, they lose it. But everybody I know, whether they're, for vaccines, against vaccines, in this epidemic, has gone through and said, I don't feel comfortable right here. And if you don't feel comfortable right there, you should pay attention to that, and you should go do something else. We talk about, the weather analogy, and on one hand, you can say, well, I'm not going to let COVID run my life. Okay, fine. But you're still not going to go out in the middle of a thunderstorm and hold a golf club up in the middle of the air with cleats on, right? Are you? Some people do, right? And they make videos of them. They call it Jackass. And,
Not the people. The movie is called Jackass.
Right. The movie's called Jackass. So there are things that just defy common sense. And I think that's really what we need a really good dose of, is common sense in responding to things as we go forward. And like I say, we'll know in the next 3 to 4 months how things are going, and certainly in the next 6 months.
Let me ask something we've tried to touch on many times. I'm going to try to, and I said this 2 weeks ago, that I would bring this up more and more, is that during this, when we were having hospitals focused almost exclusively on COVID, that other things were getting by the wayside.
Oh, yeah.
And, cancellations of certain appointments and like, not only by the medical side, but also by patients themselves, just not feeling comfortable of going into, as a friend of mine says, I'm not going into a waiting room. Everybody there is sick.
Yeah.
It's a fair thing. And when you have COVID going around, it may make it worse for them. But what right now should we be telling folks about their general health issues, the chronic issues, everything from hypertension to cardiac, I should say, to other conditions? Should they be really getting back to and getting more aggressive about getting it checked right now? Because we're starting to see a rise in. I know that I talked to several cardiologists. They say they're starting to see a rise in heart disease for people, from their own patients, even that they did not expect to see this much of a spike.
Right. So there's something called a death analysis, where you look at the number of people that died during a period of time, and the number of people who have died during the period of time that we have COVID has gone up in America. And not all of those people have died from COVID. They've died from other things, and it's because people either have neglected their health care or have been afraid to go to the hospital. And even after the hospitals opened back up, people weren't coming back initially. They were scared. And UTMB did survey people, and why aren't you coming back? And then the number one reason was, I'm afraid of getting COVID, right? Because everybody's COVID's in the hospital. I don't want to go to the hospital, and I don't want to get it. Well, I can tell you right now, in 2022, that's not the case anymore. You don't have to worry about getting COVID when you go see your doctor. For the most part, almost all hospital and clinic staff has been vaccinated. Everybody wears a mask. Everybody's very, very careful. And we monitor when we have cases in the hospital, whether they got it in the hospital or not. And we had some cases where people got it in the hospital early on. It doesn't happen anymore. And that's because it's been, we've gotten good at this. And so people should be going to see their doctor. Don't worry about the clinic. We had some guy come into the dental clinic at the health department. He had his N95 mask. He bought 2 N95 masks with him, one for the dentist, one for the dental assistant, because he didn't trust them. He had to tell him, don't worry. We've got good masks and we've got good equipment now. And everybody is very well trained, and everybody's very, very conscientious about this. Nobody wants to give this to anybody else. So, you don't have to worry about that, and go see your doctor and go take care of all of those things so they don't become problems.
And we're going to be talking about this some with UTMB officials here in the next week or so, particularly since they're our largest medical provider in the area. But at the same time, as if everybody comes flooding back at the same time, the system gets backed up again. And so it becomes this kind of, I know someone says, well, I can't get in to see this particular doctor for 4 weeks now. Used to be I could wait a week and do it. And I said, yeah, it's better to go in 4 weeks. I was one of those, by the way. I should point out I was going to go see my kidney specialist, and it was going to be like a month and a half before I could get in. And I said, well, I'm not so sure. Well, I kept the appointment and went, and then, and it's one of those things. Yeah, I had to wait longer, but eventually it all balances out when everyone adjusts. Right now, staffing is adjusted at what levels of people are coming in, not what they anticipate. And so they're putting folks where they need them priority. So that's one of the things. But do make sure you're getting a hold of your personal physician at the minimum, and go from there. Let's get into some of our viewers' questions here. Got some really good ones here today. One we get a lot, Creisha Burleson is asking, how do they determine which variant the positive cases are? Not everyone, when you get your test done, you're not also being said, okay, we're also testing you for which variant it is right now. It's more of a sampling, correct?
That's right. So we take a certain percentage of every positive test that comes in, and this is done all over the country. And so, UTMB does most of the testing in the county, and they take a certain percentage of those tests that come in, and they get sent to a specialized lab which can measure the variants. And so we were sitting there watching, the numbers go up, and then it's like, oh, we've detected Omicron. Well, most of it's still Delta. Oh, now it's about 50-50 Delta and Omicron. Oh, now it's 90% Omicron. Now it's 100% Omicron. And just last week, it was, okay, we found a couple of these Omicron subvariants, but just in 2 cases. And so that's done every single day. And that's how we monitor what's going on. So anytime there's a new quote unquote variant of interest, which is what the WHO defines it, they modify the testing procedure just a little bit so they can tell if there are any of them circulating in our community.
And when we say the Omicron subvariants, one's called Omicron stealth, I think has been the nickname.
It's been called stealth. It's going to be called B2. It's been called a lot of other things. But I don't think it's anything to really worry about. We saw the same thing with Delta. Remember, there was Delta and Delta Plus.
Right.
Everyone was worried. Oh my God, it's going to be killer Delta. Well, it turns out it wasn't different enough from Delta to make a difference either in making people sicker or in evading the immune system. And the same thing's happening with Omicron and the Omicron B2. It does seem to be more infectious, and so what they're seeing in Great Britain is that as the numbers of the Omicron variant come up, or the subvariant come up, they are seeing more people getting infected. Their numbers are still going down, but it's not going, say, like straight down like this. It's kind of curving off a little bit, and so we're keeping an eye on the curves. We're keeping an eye on the percentages of people that have the Omicron subvariant, and so far it's very minimal.
And that goes into a question I wanted to ask about, on kind of on that line, is that Pfizer was working on a more targeted booster shot that would be target like the variants and out there. Where does that stand right now, and how long until maybe it is available?
Yeah, they're testing it right now. I think the smart money is it'll probably be available sometime late spring, early summer.
Gotcha. And this is not from a viewer, but let me get this question. And we know the emergency application was put in
Hmm.
to get those under 5
Hmm.
vaccinated now. Um, Good idea. Not, I mean, we saw that we actually kind of, I think a lot of us expected kind of a flood of kids to get vaccinated when it dropped below 13. We
Yeah.
didn't see that. We saw a steady number
Right.
after some
Right.
hesitancy. But the attitudes, even the most, a lot of ardent vaccination proponents, when it came to kids, kind of backed off a little bit.
That's
Um,
right.
but what do you think this is a good idea to go for this under 5
Yeah.
vaccine,
No.
or should it be held off for a while?
No, I think it's a good thing to do. So the reason why it's taking so much longer to get younger and younger kids is that younger kids are less likely to get sick from the virus. Therefore, it's very, very important to make sure it's safe. And so that's why it's taking so much longer, because they want to make sure they have the right dose, that they're not causing any other problems. And so we went from to 13, and then we went down to to age 5, and then now we're going to age under 5, and it just takes longer period of time. They can watch the kids in the studies for longer periods of time just to make sure it's safe. So I think it's safe. I think it's going to be fine. We recognize a lot of parents don't want to do it. I have nurses that have worked for me, and they say, no, I'm vaccinated, but oh no, not my babies. I'm so worried.
Right.
And so as children get younger, that parental instinct to protect them, I think, gets stronger and stronger. And I think that's what we're really seeing, is that parents are just nervous about it. But in terms of the greater good, the more people we have vaccinated, the sooner we get done with this. The more we have younger kids get vaccinated, then they don't give it to their grandparents. And there is that unknown of what happens to kids over the long haul once they get COVID, what happens to their learning and to their brain development. And again, we don't know that, but there is some data that even came out in the past week or so that says that long COVID can look like Alzheimer's disease. And so you worry about that in little kids.
And matter of fact, Cretia Burleson has another question about that subject. Which, can we talk about people are calling long COVID or long haulers, the
Yeah,
lingering effects of having COVID?
yeah.
I'll give my personal anecdote. I've been talking about this for a while. Is that I have a noticeable brain fog
Yeah.
at times. My recall is not as good
Mm.
as it was before. So I'm going through some therapies and the like just to kind of help boost that.
Mhm.
And it's one of those things, we can't directly tie it to COVID, but we know there are cases in which folks are suffering through things, whether it's brain fog. I'm
Mhm.
even talking to folks that still have problem tasting and smelling.
Right.
Then this is more than a year later. They're still
Yeah.
having some problems.
Yeah.
Almost,
That's right.
I compared it to neuropathy of the taste buds
Yeah.
with a friend of mine. But what are, I mean, I guess that's another new phase that we're going to, well, not
Mhm.
new, but really a next aggressive phase, is to look about the long-term effects of COVID.
Yeah, yeah. So, so you can divide it up into two sections. So the first part would be about the lungs. And so if people have extensive damage to their lungs, they can continue to have problems breathing for long periods of time. While sometimes that gets included in long COVID, that's really probably not what we need to be talking about. You can think about that damage to your lungs. It's going to take you a while to get better. But when people are talking about long COVID, they're talking about the other effects that COVID can have. We know it gets into the brain, and we've known that from very early on. And so that ability to smell and taste, that's one of them. Sometimes people lose their smell. Sometimes things just smell bad for a
Yeah.
long period of time as well. And we've heard people complaining about that. The brain fog, which somebody that I know told me it was like 6 beers without the buzz.
Yeah.
And, it's just,
Yeah. I'll tell you, that's is what it's like.
yeah, yeah.
That cognitive,
Yeah,
that's probably the best comparison I can give to it.
yeah, and so then the ability to do things, to focus on things, to do mental tasks, mathematics, things like that can be very, very difficult, and that has been shown to last for months and now years in some people. And with that, there's been some studies where people have died, and they look at their brains, and they see an accumulation of these proteins that you see in people that have Alzheimer's disease. So COVID's getting into the brain, is doing something to the brain that is affecting the way that the nerves are transmitting information. And that, I think, is very clear, and it can have a long-lasting effect. Then we're seeing things such as, people having, immunologic effects, chronic joint pain, chronic fatigue. There's new data out now that it does affect women's menstrual cycle, that makes their cycles much more irregular. So I don't think we've completely figured out everything that's going on with this virus yet, and it'll probably be a long time before we get it all figured out.
Another question we've got here from, and it's kind of a combo question that we're getting from some folks here. Let me go back up to their question here. So I went away. That's, should those over 80 get a fourth shot? That's from Wayne and Wanda Hodge. And at the same time, is Galveston County administering the fourth vaccine? And we should point out that when you say Galveston County, the definition is not one entity here. We're talking about health district, UTMB, private entities, that the Walgreens and the CVSs and health clinics and your own doctors and the like, and then also the other health clinics in the area. So first is, should someone over 80 get the fourth shot? Because it has been classified as those are at higher risk.
Right. So the recommendation is a fourth shot for those who are at high risk, who are quote unquote immunosuppressed. And in some ways we know who they are, in some ways we don't know who they are. We don't sit there and quiz people as to, well, do you have this, do you have that, the other thing? Oh, that's not a good enough immunosuppression. So if you were to come to the county and say that you're immunosuppressed and you want to get your fourth shot, we'd go ahead and give it to you. If you're not sure, talk to your doctor. I think that's the best advice. They're 80-year-olds who are very frail, and they're 80-year-olds who could probably beat the crap out of me any day of the week. And so, if you're, it's hard solely on the basis of age alone to make that determination. But, people that have other types of illnesses, whether they have chronic lung disease, whether they're taking steroids, whether they're taking chemotherapy, whether they're taking drugs that suppress their immune system, or they have anything else that could make them immune suppressed, we're recommending that those folks get a fourth shot. And it's interesting, the CDC now has actually changed the criteria for it. They've said that instead of waiting for 6 months, to only wait for 4 months. So again, you're seeing this kind of push-pull between what does the data absolutely show us versus what does common sense tell us, right? And sometimes common sense is right, and sometimes the data is, we don't have any data for it, so you probably shouldn't do it. But sometimes, common sense overrules that and turns out to be okay. And my bias is that, if you're worried about it and you have a reasonable, I want to say belief, but good reason to think that you may need the fourth shot, go ahead and get it.
There's a question that asked by Dolores Howard. I'm interested in this answer from you. Do overweight folks need to get the fourth shot also?
My answer stands.
That's it.
I wouldn't tell you no, and I'm not going to tell you absolutely yes, because again, that falls in that gray zone, and we'd have to sit, and from a if I were your doctor, I would be able to sit down and talk to you about all the details in your health and what your underlying conditions are that go along with it. So, but from a public health point of view, where people just walk into a clinic, that's probably not the best thing to do. We don't want to get in fights with people over whether you're quote unquote sick enough to get it. And there's probably not a big downside to getting the fourth shot.
Here's a question. You and I answer this a lot. What percentage of COVID cases are vaccinated, and why are people who are vaccinated getting COVID? I think it's a legit question. I think sometimes folks will hear, particularly when they see that daily report that Ashley Tompkins puts out, and I think one of the deaths that we had most recently reported was someone who was fully vaccinated. It was in their 80s, and while yes, there's more and more folks who are vaccinated, fully vaccinated, test or having health issues from COVID, it still is a low percentage of the numbers, is it not?
Sure. Yeah. So we've had about not quite 7,000, I think 6,000, almost 700 people that have had quote unquote a breakthrough. That is, they've been vaccinated and then they got COVID. That's out of over 250,000 people that have been vaccinated. Okay, that's pretty amazing. All right, and then when we look at those 250,000, only about 170, 180,000 of them have gotten their booster. So a lot of those people are people that have only gotten 2 shots. And so when you start doing the percentages of that, that's less than 1%. So these vaccines really are very good and very durable. And we would encourage everybody to get every vaccine that they're eligible for, to protect themselves to the max. But when you compare that to people who have never been vaccinated, those are the people that are really getting COVID. That's far and away the majority of the cases that we're seeing.
Right. And let me go back. And you're telling me how many of what we call the breakthrough cases have there been? You said about 7,000?
About 7,000, 66, 6,700. Yeah. I just saw the report and I'm trying to remember the number off the top of my head.
And we got more than 250,000 that are vaccinated at this point.
Yeah.
So 2.6%, let's give it, we'll round it up, 2.7%.
Okay, there you go.
Of those, of the cases are breakthroughs.
Yeah.
So how that helps out. There's actually there is a place you can actually track this. It's interesting and we'll bring it up next time too, because I found myself hours going through the data that Health District maintains on this. Not only does it keep like regular breakthroughs, it keeps like if you had COVID, got vaccinated, and had a breakthrough case.
That's right.
If you had COVID and got COVID again.
Right.
It's broken down all the way across that. It was quite interesting to see all that data. Still, when it comes down to if you're vaccinated and a breakthrough case is a little under 3% of those. We hear about those because they are the outliers, I guess would be the way to describe it.
It's the unusual thing. We were all thinking that, well, if I get vaccinated, then my risk should be 0. Well, that's not right. And that's not right for any vaccine. And so there are always some people who don't respond. The bottom line is, regardless of whatever state you're in right now, if you get vaccinated, you will do better. And that includes people who have had COVID. In fact, there's more and more data coming out that suggests if you've had COVID and you get vaccinated, you are the most protected people on the planet. And so, that's why we're encouraging people to go ahead and get vaccinated.
Because and at first it wasn't acknowledged as much as it probably should have been.
No, that's definitely true.
Once you had COVID, that there was some level of protection.
Yeah.
Early on, whether it was data or for whatever reason, it was not being acknowledged as well. But now there's a lot of the science behind this that shows if you had COVID, you are protected for an amount of time.
That's right.
Now, it wanes faster than the vaccine of all the numbers we saw, or is it?
That's changing. And
yes,
so our understanding of that is changing. And so there's probably a more robust immune response to getting the natural immunity, which makes sense because you're getting the whole virus and that you get exposure to that whole virus. And so therefore, you'll have a much more robust. The problem is we don't know how long it's going to last because we haven't been able to follow people for a long period of time. And we also know that if you've had that and then you get boosted with a vaccine, that you have even a better immune response. But I know people that have had COVID, got vaccinated, and then got COVID, right? And sort of like you broke all the rules. That wasn't supposed to happen, but sick for a day or two. So it kind of goes back to what it was to protect you. And as to why that was underreported, I think it was 2 reasons. One, there wasn't a lot of data, but there was also, and I got to be very upfront about this, there were people in the public health community who felt like, well, if we tell people that if you get COVID, you're protected, then people won't get vaccinated. And they were afraid. They were afraid of acknowledging that. And, my position on this is that we need to be as completely honest with people as we can, because, one, people need to know. And 2, if it just erodes trust when you try and spin the story to get the outcome that you want.
Well, and again, I don't want to toot our horn too much here, but I think we have done a service here in the show now 2.5 years doing this on a more regular basis, is that when there's been something said that changes, you acknowledge it on the time, or I make you acknowledge it. I don't make you acknowledge it. I'll bring it up.
I would hate for you to go back and find all the stupid things.
Every once in a while I go back because, and I bring this up jokingly with you, but it's like hey, when we were first dealing with it, come to the beach, come to the, I remember that line.
Hey, I was right on that.
You were right on that, as it turns out. At first, we thought, oh, not so sure, but as it turns out, that was the better way of doing it. But a lot of folks were even doubting that. But it's one of those that, like, hey, you go back and you look at it a little bit later. Go, okay, but as you get more data, you get more information, and you go, hey, just as and you and I, and you've been one of the first to acknowledge this. Listen, how the health care community has handled the communication from the higher ups, and many times has been really bogged down in bureaucracy. And I think in many ways too, we're also seeing what is normally held in an academic administrative level away from the public eye. Right. And then some recommendation comes out. But on this one, it was almost we were watching everything in real time.
Well, that's true. And I think people aren't used to that. And, in academia, sometimes, the person who says things the loudest and the most confidently often wins the argument in the short term. And I think we saw some of that. And, we see people jockeying for position and, just, all the stuff that people do, right? We're in academia and healthcare are no different than anyone else. There are people that have ambition and they want to get recognized and sometimes see saying things a little over the top as a way of getting there.
Another thing, I guess, would be while not maybe a direct symptom of COVID-19 is mental health. Just with everything that's going on, waiting for the next shoe to drop, all the restrictions that were in place or things we worry about. And one thing I do want to bring this up. I want to show this to folks on the screen right now. Let me go to this. Hang on, I'm going to change this out, folks. Sorry, I'm going to remove this and bring up something else. Here we go. Nope, not that. Sorry, folks. I need to get the right screen up. Here we go. We want to get the right screen up for everybody to see here. And it's going to be this one. So some UTMB students are doing a survey. You can find the link to the survey, by the way, on the Galveston County Health District's website under their COVID-19 page. And it will take you to this Google Doc form that the nursing students at University of Texas Medical Branch, UTMB, is doing a short survey. And here are the questions. How old are you? Are you a resident of Galveston County? And they're actually looking at the mental health toll that COVID-19 has taken on people, those who have had it, who haven't had it. I wonder if you can talk about what's being learned more now about dealing with the mental health side of this. And I bring it up too because there's also what's been called the polarization via political that's also brought in a lot of stress. I know Jeff Templer and I were talking about that a few months ago, that you can see that strain of just the political rhetoric has gotten people on edge too.
Yeah, well, there's no doubt that I think what COVID and the lockdowns and restrictions have taught us that we are social creatures, right? And that when you deny people that, it has a negative effect on people's mental health. I think I see from my personal experience, I see it from the position of being a healthcare provider, and then it's very insidious there because on one hand, we weren't locked down, right? We got to go to work every day. In fact, we were expected to show up, and we did our work, and there was a lot of it, and in some ways it was very, very meaningful and important because you felt like you were making a big difference. But on the other hand, something bad happens, you just get used to, okay, move on, and you always defer and you push it down and you push it down and you push it down, and I think that's why so many healthcare workers are now having issues with PTSD and having issues with depression and burnout, and it's just like, oh my God, when is this thing going to be over? And so it's really hard, and I think everyone else is feeling that. But when you see, I think when I look at and talk to family members, they're in a different scenario. They're kind of, you can't do this, you can't do this, you can't do this, and it's very depressing, and we don't know who to believe, right? They hear so many voices, and so it's frightening, it's scary, and they don't know if they should be scared or how scared they should be or what they should be scared about, and they can't see their family members, and they get depressed and they get angry and they get upset. And so I think we're seeing a lot of anger and a lot of depression. And I think that's just, a consequence that we're going to have to deal with for a while. And we're going to have to figure out better ways of doing it. And unfortunately, meetings by Zoom are not the same.
They're not.
Right. It's just not. And it's not the same human contact.
As I stress to folks, we do this now just because it's convenient for you and
right.
I. At first, it was because of health. As I said 2 weeks ago, you and I see each other out and about all the time. And we do this now. It's just we end up on two different parts of the county and getting into the same spot. This just makes it easier for us along the way. Let me bring this back up again. If you go to the Galveston County Health District website, there is on there. It's under the Public Health Services COVID-19 page, this is it. It says COVID-19. Scroll to the very bottom here, and you can click on the link. And this is the survey from UTMB nursing students right here that you can click onto. I filled this out already myself and found it interesting. Just the questions asked, they're pretty basic stuff, but it's amount of data that we can have. But there's other resources here, by the way. The dashboard we show you all the time here, but there's also information, the daily reports that the office puts out. If you're if you need to know where to get tested, where to get vaccines, you can even just track the school districts on your own here. In fact, as well, within the health district, this is just the school district's tracking that's available. So if you are worried about that, how many are students versus how many are staff in there, and it breaks it down as well. So that information is all available. There's a lot more detailed information available on the COVID-19 page of the Galveston County Health District. So take advantage of that when you get a chance out there. It's so they're a good resource to have along the way as well. As always, data is always the most important thing. As I said, that's why one of the things we do this is give you more information. I wanted to ask you this last question here, and it's not necessarily COVID related, but it's an area in which you spend a lot of time in HIV and AIDS. Today, this last week, I should say, I found it to be exciting news that an mRNA vaccine being developed for HIV.
Yeah, very
They're
cool.
working on that. Yeah. And in many ways, while mRNA, which is, basically, is the Pfizer and Moderna vaccine. So we have it's mRNA, has been around for a little while, being tinkered with on different things. It has never been in mass production for vaccines until COVID came along. And that's how quickly it came along. But now something has been stuck when we're seeing a lot of the HIV treatment drugs finally coming on the market in a mass force where you see the commercials on a regular basis. But I know this is an area that has been passionate for you for many years. Just talk about, what do you know of this? And as I said, the moment I saw this study come out, I thought of you because of the many years you spent on HIV and AIDS, infectious diseases, because you were on the front lines early on with this. Yeah. But to see something coming along using mRNA possibly as a vaccine.
Well, it's very exciting. It's very helpful. Since 1983, people have been trying to develop a vaccine for HIV. And in fact, when the virus was first discovered, the Secretary of Health and Human Services had a national press conference saying, we discovered the virus and we'll have a test within months and a vaccine in a couple years. And there's still no vaccine. In fact, at one point, I was at a national conference in the early 2000s, and the question was, the presenter was, should we continue to try and do vaccine trials? The answer was no, we don't know enough. We've wasted literally hundreds of millions of dollars and just trying to get something, and nothing seems to work. We need to go back to the drawing board. We need to understand how HIV eludes the immune system and develop a vaccine for it. And so now you fast forward to COVID, and suddenly we have this new virus for which people have been trying to make a vaccine for years, because coronavirus vaccine has been very, very elusive, and people have tried all different sorts of things. And then, okay, we've got this mRNA vaccine, and it, works a little differently, and it's got a good antibody response. And if it came out and it was 50% effective, we would have been ecstatic, right?
Right.
But it was out of the ballpark, over 90% effective, and absolutely astounding. So that tells us this technology is very different and does things to the immune systems that other vaccines don't do. So for me, it's a real era of promise. And I would love, before I retire, to cure somebody from HIV or to give somebody a vaccine so they can't get it, and then just be done with it. That would be the whole arc of my career, because I started off as a young man when we had no therapies for it. And it would be very cool to be able to finish off my career doing a vaccine campaign for HIV. I've already done a vaccine campaign. That's easy now.
Yeah, right? yeah, right. You've got the practice.
How to do that.
Well, as I said, when I first saw this study last week, I delved down into every document I could find on this and looking at the presentation on it. And I was thinking about you because you were on the front lines of us early on in your career. And full disclosure here, my aunt, who's a professor of nursing at UTMB, she teaches nurses on the graduate side on medical ethics in the early days, dealing with HIV and the ethics of medical treatment, which is a whole topic by itself, by the way. And so I have always followed this a lot and have been fascinated. So I was thinking about both of y'all when I saw this coming out. The hope, as I say, because we have seen the effectiveness. I know some folks want to knock it, but the numbers don't lie, folks. I'm sorry. We have the numbers here to show how effective it is. Do we know long-term effects? Not all of them yet, but right now the data is showing it's safe. Yeah. But I will point that mRNA, the promise of that, we talked about it. I know talking with Dr. Shi early on about where this was all headed with coronavirus, and he talked about the same thing you said. We've been trying to find a vaccine for coronavirus forever. We may have gotten a whole lot closer to COVID-19, trying to make a silver lining of what's been a really bad pandemic. But if there's going to be something that comes out of this, my hope is that because mRNA is also being used in the COVID pills and everything else that are being developed by Merck and Pfizer.
Yeah, and we may see applications outside of viruses. People are talking about using it for cancer therapy and for other types of things where you need to boost the immune system in some way. And so I think we haven't begun to see everything that the mRNA vaccines can do. And I think COVID kind of whetted the appetite. Like I said, nobody expected it to be as good as it was.
But that's also kind of the history of medical research?
Yes.
Is that it takes something really bad to get that next jump.
Yep.
You don't get those, you get the jumps when it's, that's why I don't think it's as pie in the sky as when President Biden announced last week he wants to take another swing at cancer out there. And that's a whole different bailiwick than we're talking about with a virus. Yeah. But that it was, and it reminds me of this kind of the West Wing episode of, hey, if we do this, and this, we can cure cancer within our lifetime. Well, that may be too bold of a statement there. But that what we're seeing in medical research in one area, people will say, wait a second, what if we tried that here? And I liken it to when we were doing our breast cancer awareness back in February, everything from testing teardrops and everything else, so the studies from that of showing risk for cancers and the like were coming out. And something that sounds simple, and you realize they found that because they were looking at something else. And that's the way medical research goes. You're looking for one thing. Sometimes you find something else along the way that's just as wonderful or just as catastrophic. And those are the things. Yeah, because that happens. I mean, that happens as well. And anyway, as I said, I just wanted to bring that up because I know it was exciting for me to read. And I knew you'd get a kick of talking of it too. And I hope you get to hit that part of ending your career too.
That would be fun
as well. It'd be good for that. And in your position you're at now, you get to, as you said, you've already done a vaccine campaign. And
that's right. I mean, just give it to me. We'll do it.
Yeah. I don't think we'll have the same long lines at the county for that, but we'll see out there. But great. Dr. Philip Keiser, the CEO of the Galveston County Health District and also our local health authority. I am impressed. I need to point out to folks that Dr. Keiser does have paintings hanging up in his office now, and he has furniture in his office now.
Yep, there you go.
Yeah, he got the job while we were doing this. Oh, well, look at this. You got furniture on that came in. You got stuff on the walls.
Yeah.
Obviously, because I know how you are. You would have a guitar in your corner. That'd be about it.
Well,
I
that's
think
next.
yeah, that's it. The guitar would be in the office here. One day we'll have Dr. Keiser serenade us on here. But we've been doing the show for so long with these empty walls and no furniture, and I'm just glad that we have furniture in your office now.
Yeah. My staff has helped me a lot.
That's good. Good of them on the way. So we're good to have that done. Dr. Philip Keiser has been on with us on What You Need to Know. We'll be back next week with the show. And we're going to delve down a little bit next week into more kind of the breakdown of the data of those who have had COVID, the reinfections and the like as well, and talking about those next steps. And we hope to have more of a discussion later next month on the long haul program. We're going to bring on some special guests with us. So thanks for coming on, Philip. Good to see you again, sir. Have a good one. Give my best to your wife. Thank you all for watching. This has been What You Need to Know with Dr. Philip Keiser here on I-45 Now.